taking your calls today for Dr. Zorba Pastor. The number to call is 270-9933.
If you have any medical questions for the doctor, call in now. But first, Zorba, good afternoon to you.
Afternoon to you guys.
We're talking about salt now. That for some people, consuming salt is not necessarily a health risk.
Well, it's very, very interesting. So this is a study out of the journal Lancet. We've gone back and forth on salt. The American Heart Association and the World Health Organization has said no more than maybe a half teaspoon, maybe a teaspoon at most of salt. And finally, we've got a very, very good long-term study. So the study, first of all, was published in the Lancet. That's a very prestigious medical journal, just like the New England Journal of Medicine. They followed roughly 100,000 people from the age of 35 to 70 years old and followed them for 8 years, looking to see who had heart attacks, who had strokes, and how much salt did they consume. And lo and behold, as long as you stayed below about 2 to 2.5 teaspoons of salt a day, you seemed to be okay. The risk of stroke and heart attack did not seem to be above that. Now, keep in mind, we've been telling patients for years and years and years, no more than a half teaspoon of salt. And I think this study shows that maybe we have been wrong, and people can use a little more salt. Now, that doesn't mean go and put salt on everything, but it means that if you're on a low-salt diet and a really low-salt diet, you can take that shaker and put a little bit more salt on it, and you're probably just fine.
That's the best news Mark's heard all day, because you got a low-sodium diet.
I am, but you know, you talk about teaspoons of salt. There's salt in everything, so you're not just eating salt.
No, and that is the other thing. You've got to look at prepared foods, because prepared foods have lots of sodium, and the reality is that is sodium you don't need. My recommendation always is do not cook with salt, and then when you take the food out and you put it on your plate, put a little bit of salt on the surface, and you will inevitably use less salt. If you cook with salt, you've got to put a ton in that food to get it taste that, and that's why prepared foods are often loaded with sodium. So still, read those labels, stay away from sodium-labeled food, but the reality is you can use the salt shaker gingerly.
Right.
You don't have to simply forget it at all.
Well, I was on a low-salt diet because I had kidney stones years ago, so that was the concern there. It wasn't cardio or anything like that.
That is a different issue. That's a different issue.
All right. Let's go to the phones. Let's start with Betty in Madison. Hi, Betty. Betty, you there?
Yes, I am.
What's your question?
My question is, you know, I do not like salt, so I use very little. But I think that it, you know, you get more muscle cramps, and are you not worried about the thickening of the blood?
Okay.
Well, there are a couple things. First of all, salt does not cause muscle cramps, does not cause the blood to become thicker. It doesn't do any of those things. On the other hand, it's really good to get used to other seasonings. And going to other seasonings, such as Mrs. Dash and other seasonings that do not have salt, are really good. Americans love salt, and they often shy away from hot spices. And the fact is, hot spices or other spices are good for you. But it does not cause blood thickening, and it does not cause other issues that many people think salt does.
All right, that's good to hear. Let's go to Larry in Cambridge. Hi, Larry. What's your question?
I'm calling in regards to I had leukemia cancer over 4 years ago, and the doctors told me that I had to be heart muscle medicines the rest of my life because the chemo I was taking weakened my heart muscles. And my heart specialist never called me back in 4 months after I started. Is there something I should worry about?
Well, I think it's always what's really important when you've got anything wrong with your heart. You want to have a good relationship with your primary care doctor and with your cardiologist. Because the reality is sometimes things fall beneath the cracks. You know, maybe you should get a call back, something happens and you don't. So as a patient, it should be your responsibility to call up and say, hey, what's going on here? And by the way, with Epic, the electronic medical record, it's so easy to put off a note, send it to your doctor. The nurse or the doctor will answer you back. So the answer is yes, I would definitely follow up on that, for sure.
All right, let's go to Kim in Wisconsin Dells. Hi, Kim.
Hi.
Hi, what's your question?
I have a question about salt.
Okay.
You said not to eat no more than 2 teaspoons of salt. So
2.5 teaspoons, that's right, at most. Now, I'm not recommending you have 2 teaspoons of salt a day. They were just looking at the high level and whether or not there really was evidence that caused heart attack, stroke, and other cardiovascular problems.
My question to you is, I run low blood pressure, I'm not one that runs high. I run low blood pressure, and the doctors told me to eat salt.
Well, if your blood pressure is low and you're not dizzy, there's nothing wrong with actually running low blood pressure. A lot of people have a blood pressure of 100/60. Often thin women will often have a blood pressure that's that low. If you're not dizzy, if there's nothing wrong with you, you do not have to have salt to elevate your blood pressure. So I would respectfully disagree with that advice. Unless you're dizzy and fainting, you don't need to take more salt.
All right, our next caller has a question about vertigo. Go ahead.
Yeah, I have a lot of the vertigo problems going on, and I'm having so many migraines, and I'm hearing there's a lot of people that this is going on, and I'm wondering what I can do other than I know I'm going for an MRI and test for it.
Oh, sure. Well, first of all, with vertigo, there are many different treatments. One treatment is something called Epley's maneuver, EPPLY''S. If you go to the internet, to YouTube, you can see what it is. Physical therapists do this, and they often help for people who have dizziness and vertigo. It's a physical therapy, non-drug way of actually improving it. And when it comes to things like that, staying away from a drug is often useful. As far as migraine headaches, MRI scans, that's where you have to sit with your doctor, decide when you need a scan and when you don't. Migraines are very common, so is vertigo, and both of them together are not an uncommon combination.
All right, let's go to Mark in Beloit. Hi, Mark. What's your question?
Hey, I just want to know, is sea salt better than a regular iodine salt? I just wanted to hear the comment.
Well, the issue with iodine salt is before we put iodine in salt, the Midwest was known as the goiter belt. My grandmother had goiter. I had 2 aunts who had goiter. I had a cousin who had goiter. And once we put iodine in salt, because you need iodine, then we stopped getting rid of goiter and our thyroid started functioning. And sea salt does not have enough iodine in it. So I think it's very important to have iodized salt, especially for pregnant mothers and especially when you're growing up. So using a little sea salt for taste, if you like it, is fine. But I think iodized salt is really the way to go.
Well, you struck a nerve with this salt thing.
We're all interested in salt.
We're out of time. Thanks, everyone, for calling in. And Zorba, we'll see you next time.